Thank you very much, Khaled, for having me back to do part two. Just one little logistic matter about the slide deck. For those of you that were participating in part one and may have the deck for that, I've made some changes. So the one that's up on the screen now is the one that I'll be going through today. And if we could go to page 30, because I did include all the previous information on Ontario. So here we are, starting at page 30. And what I will do today is go through the research requirements for the provinces of Alberta and BC, as Cal had mentioned. So now let's see if I can move the slides along. Oh, technology is against us today.
Do you want me to do it for you?
If you could, I thank you, Khaled.
Okay.
Because the first slide just goes through some terminology that I wanted to put out there to distinguish it from some of the common terms that we use in Ontario. So custodian is what we call in Ontario a HIC. Data matching is as described there. There's a very broad definition in Alberta of health information, which includes registration information, particularly for research and other matters. Individual identifying information is important, as is a repository, and the definition of research. So it's very clear that under the HIA, if an activity does not require what the Act calls individually identifying information, it is not considered to be research under the HIA. However, there is one exception to that, and that is if a custodian in Alberta is disclosing non-identifying information, for example, to a researcher who's going to use it for data matching purposes, the commissioner must be advised prior to doing that. So the next slide, if we could go to the next slide, perhaps, there we go. It indicates one of the sort of many differences between the Alberta Health Information Act for research purposes, as well as that in Ontario. And one of the things that's important to note in Alberta is that the Act itself sets out what designated research ethics boards, or as they're called sometimes in the Act, ethics committees. So the regulations under the HIA have designated 6 specific REBs, as we call them, as those that may undertake the requirements in the Act that relate to ethics committees. So let's have a look at sort of the nitty-gritties of how one goes about accessing health information in Alberta for research purposes. So the next slide indicates that a custodian may use or disclose health information for research or for data matching purposes. And it sets out certain criteria that a custodian, if the custodian is using it, or a researcher who wants to access it from a custodian, must meet in order that the information may be used to disclose for those purposes. So a proposal's got to go to a REB. The REB's got to be satisfied that the proposal meets the criteria in the Act. Perhaps the Research Ethics Board may require certain other conditions. And one of the particular things that I think you'll see in all research provisions across the country is whether or not there's a recommendation from the Research Ethics Board that the researcher needs to obtain individual consent prior to the information being used or disclosed. The next slide indicates the obligations of the researchers. So we can sort of walk through how the process works from both the perspective of the researcher and what they have to do and the custodian and the rep. So researchers have to submit the research proposal, and the proposal has to include certain elements in it. So, for example, if the research project is to proceed on consent, then the researcher must include the consent form, and that's going to be used for the project. And, of course, the Act, the HIA itself, indicates what the requirements are for consent, not just for research purposes, but more generally under the Act. And if the project is not proceeding on consent, and of course the researcher in that case is requesting a waiver of consent from the rep, there has to be an explanation as to why the consent's impractical, not feasible, or unreasonable. The proposal also has to include, as indicated on the next slide, and again, this is something that's common across the country, sort of the balance of the public interest in the research outweighing individual privacy. And that, of course, is when you're not having a project proceed on the basis of consent. So here's the laundry list of basically the public interest, I guess, objectives that you can set out in the research proposal to justify why the project must proceed and needs to proceed on the basis of no consent. So these are common things, as I said before, that we will see. And the next slide indicates other things that the researcher has the requisite qualifications. And the other piece that is, in my mind, kind of interesting, and sometimes, there's an issue with respect to REB's understanding of this, but it links research and the general requirements under the HIA, and that is the inclusion in the research proposal of the type of safeguards we generally think about with respect to protecting health information. So safeguards in the three categories of administrative, technical, and physical. So your researcher, you've gone to one of the 6 REBs in Alberta, and you've included in your proposal all the criteria under the Act, and once you get your REB approval letter, you may go to the custodian and request the information. So after you do that, number 4, as a researcher in your process, you submit your letter to the researcher and you include a written application for disclosure. Now, one of the things that I found very interesting when looking at the Alberta research provisions, which is very unlike those in other provinces, is it explicitly deals with costs. So, for example, if there are costs to the custodian with respect to obtaining consent, preparing the information for disclosure. So, for example, if the data sets have to be, created in a certain way, eliminate certain data fields, copies, that kind of thing. So, the custodian may charge those back on a cost recovery basis to the researcher. And again, in applying to the custodian, if there are data matching requirements that are set out in the REB approval, the researcher must indicate how they are going to comply with those when the application is submitted to the custodian themselves. So the next thing that a researcher must do, and again, this is a common element that you'll see in legislation across the country. They vary a bit, but under the HIA, of course, the agreement must comply with the Act, any regulations, any requirements imposed by the custodian with respect to the information, as well as the safeguards. It may be that the REB has imposed additional requirements that you'll incorporate into the agreement, as well as the requirement not to contact research subjects. And again, this is, if you look at 7C number 2, and this again, like costs that are indicated below, represents the approach of the HIA in looking beyond the research agreement itself and sort of considering practical implementation matters that may arise between the researcher and the custodian. So, for example, it almost allows in C sub 2 custodian access rights to researchers' premises. So basically audit rights to ensure that the researcher is complying with the Act and any requirements in the agreement. Turning to the obligations of the REBs in this case, the Act sets out certain things that the REB reviewers must look at, and they basically mirror those of the research. What's kind of interesting, again, to me, is this intersection between privacy legislation sort of, I wouldn't say intruding, but I'd say sliding over into the actual operations of research ethics boards themselves. But where there is a difference between Ontario and the other provinces, including Alberta, for those of you who were on the other webinar or are interested in it in Ontario, Ontario goes even farther than Alberta does, and it sets out that one of the members on the Research Ethics Board must have privacy experience. And so I think from a practical perspective, sometimes what people have indicated to me that they found is that while REBs certainly have membership with vast experience in health research and ethics issues, sometimes they don't quite understand some of the privacy issues. And it makes for some challenges, particularly as we've seen, where REBs have a specific obligation to look at the consent management issues in a research proposal, i.e. whether or not the researcher is proposing that consent be waived and the reasons therefore. So in my professional opinion, I think it's really important that privacy expertise is sitting at the REB table. The obligations of REBs in continued in number 2, again, they sort of mirror those in Ontario. And, not only actually in Ontario, but the flip side of the requirements that have to be made in the submission and the proposal by the researcher. And at the end of the day, the REB decision is set out in the next slide. They basically have to include their decision regarding consent, summary of the assessment, and as I mentioned earlier, any other conditions they may impose on the researcher. And as I said, those are conditions that will be incorporated into the research agreement that the researcher will sign with the custodian. Another difference that we see here between the Alberta requirements and those in Ontario is that of the involvement of the Privacy Commissioner. And in Ontario, the Privacy Commissioner generally doesn't get involved in this space, but in Alberta, the HIA requires that the Ethics Committee forward a response not only to the researcher, but also a copy to the Commissioner. I'm not quite sure why, because the Act doesn't require the Commissioner to approve it, to review it, anything like that. As far as I can tell, they're just kept on file with the Commissioner's office. If we move quickly to the obligations of the custodians, again, if you map out sort of the requirements of researchers, those of reps, those of custodians, you'll see, not surprisingly, that there is a process whereby the obligations of the parties and the decision-making requirements of all of them fit together in a coherent process. I'm not saying it's efficient, but from a process perspective, they all work together. I'd like to highlight number 2, and this is the custodian's requirement to make a decision on whether to disclose the information to the researcher. And it's really important to point out that the HIA, again, similar to all the privacy legislation across the country, allows custodians the discretion to disclose the information to the researchers. So that means that even though as a researcher you may have all your T's crossed, all your I's dotted, you may have your rep approval letter, that doesn't mean that the custodian must disclose the information. So when I've spoken with people about that, from a practical perspective, it makes sense as a researcher to do some, proactive communication work with the custodian from which you will be requesting the information before you start the formal process, because it makes no sense to sort of prepare a proposal that you initially send to an REB if at the end of the day you find, for whatever reasons, the custodian is not willing to disclose the information. And again, speaking with folks in the field, sometimes custodians feel that it's too much trouble to either put the information together, to review the paperwork, to sit down and negotiate the research agreement. So in the interest of efficiency, it's a good idea to, do your perhaps proactive due diligence work with your custodians first of all. Again, if we move on to slide 3, you'll see what the mirror obligations of the custodians are. And again, the cost can be included in the research agreement itself. That's going to be signed with the particular researcher. And the custodian also has to verify, as we see on the next slide, that if the project is proceeding on the basis of consent's been obtained. And again, this is an obligation of the custodian, and that is that even though, you've got approval as a researcher and everything like that, consistent with sort of best principles, and again, in conjunction with the researcher request, we see that the custodian has an obligation to disclose the data and prepare it at the highest level of anonymity. So basically, this is going to entail, and again, another reason for proactive due diligence, in terms of the scope of the data that's being requested and maintained by the researcher as being required for the research project. So it's important to get, your data parameters down pat up front, again, so that you're not faced with a situation being a researcher whereby the custodian at the end of the day says, well, help me understand why you need all 25 attributes on an individual level record where your thesis seems to suggest that you're only going to need 20 of them. This is also we'll see another example in the HIA where the research agreement is not the end of the process with respect to legal obligations under the Act. For example, basically, again, the Act allows the court to provide an order to the researcher to grant access to the custodian if the researcher denies access to the premises. And you'll recall that custodians do have what I call an audit right to basically ensure that the researcher is complying with the terms of the agreement. So that's followed up here, and we'll see that on the next slide there is a process whereby the court can really intervene here. Under obligation number 4 on the next slide, if the researcher doesn't comply with this. So one more point I'd like to make about Alberta, dealing with disclosures outside of the province, which is indicated on the following slide. And certainly those of you that are familiar with the Alberta Health Information Act, there's a general provision in Section 8, the regulations, about disclosures of health information outside of the province, and they're generally applicable to disclosures, not just to research. But if the information is to be disclosed to a researcher outside the province of Alberta, these provisions in the regulations should be included in the research agreement. You will see that sometimes there's an overlap with respect to, for example, number 3, maintaining of safeguards for the security and protection of the information. Certainly that mirrors in many respects the requirements in a research agreement generally that security safeguards be applied to the data. So you'll look through the laundry list of requirements for the agreement that are either set out in the legislation, required by the REB, required by the custodian, and if the data is going outside of the province, set out in the regulation. And so all of those requirements together will form the terms of a research agreement. So, quick summary on Alberta. In the next slide, consent's not needed to disclose health information for research as long as the Act requirements are met. REBs are designated in the legislation. There are 6 of them. Responses of the REBs go to the Commissioner. There are cost recovery and cost provisions in the Act, particular requirements for data matching, and custodians have specific legislative remedies if the researcher declines to allow inspection of the premises to permit the custodian to ensure that the researcher is following the requirements of the agreement. We'll move out to the West Coast and BC, and you'll see in the sort of blue bar under here that there are 3 pieces of legislation that deal with accessing PHI, or health information, for researchers in that province. And I will tell you, as we see on the next slide, that from my perspective, as is shown in the overview here, it's pretty complex in that, unlike Ontario, where we've got PEPPA, and Alberta, where we've got the Health Information Act, there's no one piece of legislation in BC where a researcher can sort of go and say, all right, now I understand these are the rules, and I will go about, preparing the documents to get the research data that I need. And essentially, the model in BC is broken down and based on the source of the data that you want for your research project. So, for example, under FOIP, which those of you from BC know very well, the Freedom of Information and Protection of Privacy Act, this is the public sector privacy legislation in BC, and it applies to all information, not just health information, that's held by the defined public bodies and healthcare bodies. So, as an example, the healthcare bodies that fall under this act include the Ministry of Health, public hospitals, mental health facilities, and universities. So those are some of the healthcare bodies from which you may want to access data for a research project. So then we move to the private sector side, and we have the Personal Information Protection Act of BC. And this applies to personal information, including PHI, that's held by private sector organizations. So examples that may be relevant for research projects are physician offices, pharmacies, and private laboratories. Now, the third piece of legislation that applies, and we see it on the next slide, is the eHealth, I'll just call it the eHealth Act because it's got a very long title. So it applies to designated, what are called health information banks, and in the designation order, and we'll discuss the eHealth Act in more detail in a minute, but in the designation order creating these HIBs, health information banks, they may authorize the collection, use, and disclosure of the information in that HIB, in that health information bank, for a number of purposes, including research purposes. So at the end of the day, you've got this scheme in BC whereby the particular rules related to accessing health information for research depend on the source of the information that you wish to access. So let's just take a look at the provisions in these three pieces of legislation. So remember, we've got FOIPA, so if you're applying, for example, to access data from a hospital or the Ministry of Health. So again, like legislation we previously discussed, identifiable, i.e. personal information, may be disclosed without consent. Again, if the purpose can't be reasonably accomplished unless the information is provided in identifiable form or the purpose has been approved by the Commissioner. So again, we see in BC pieces of legislation in which the Privacy Commissioner gets involved or may get involved in research projects, which is something that you don't see in Ontario. Again, no contact. We'll speak to some exceptions in a minute, and data linking isn't harmful. In part one, actually after part one was finished of the webinar, I did get some questions about the impact of the amendments to FOIPA that were made in Bill 3, which came into effect last November, I believe. So I will address them as we go along, but you'll see already here that in number 3, I've used the word data linking as opposed to record linkage. And that was one of the changes that came into effect as a result of Bill 3. And from where I sit, I think that's probably a much more accurate term to describe what actually happens. Records may not be linked, it's data that's linked. So I've already included, as I said, that amendment here in this particular slide. As we go on to the next slide, with respect to the criteria required if you want to access data from a healthcare body or a public body, we see here that the approval comes from the head of the public body, and which is, to my mind, a little bit strange, but with respect to health research, but that's okay. And a research agreement is still required. However, unlike legislation that deals specifically with health information, for example, as we saw recently in Alberta and Ontario, the conditions aren't set out in the FOIPA. So basically, the public bodies have templates themselves that are used as a basis of negotiation, but there are no requirements set out in the Act itself as to what type of provisions must be included in these agreements. Now, if we turn to the next slide, we'll see that, again, there's more involvement, potentially, of the Commissioner's office in BC. So the Commissioner can approve the research purposes, can approve the use of the information to contact the individual. I know that a number of years ago this was a big concern with respect to the way the research provisions were initially included in the Act, and there was an absolute prohibition against contacting research subjects. So this was an amendment way back when. And if the Commissioner does provide such approval, she may set the requirements as to how that has to work in process. I've included here one of the other updates, other amendments that came into effect last fall under FOIPA. Initially, when the Section 33 prohibitions came into effect a number of years ago in FOIPA with respect to non-disclosure of information outside of BC, they affected research as well. So this change was made last fall so that information may be disclosed outside of Canada for research purposes. And again, here we see how there's a disconnect between accessing information for health research purposes under FOIPA and what we generally think of as really good practice for health research. And that is, there is no requirement that any of these disclosures by public bodies for research purposes be approved by a REB, or rather that the researcher get REB approval prior to accessing the information under FOIPA. However, as a matter of policy and practice, public bodies may require that in certain circumstances. Let's turn now to a couple of the amendments that I have yet to discuss in B3. Now, I got a lot of questions last time about the data linking amendments, but there's a critical exclusion for those new data linking amendments under what was then Bill 3. and you'll see that they do not apply to the health sector. And again, last time I looked, there were no regulations that were prescribing the health-related organizations. So I thought that was kind of strange, but if you look at sort of the genesis, if you will, for the data linkage requirements, they were really based, I think, to a large degree on the submissions of many of the government ministries and their proposals to link data across all ministries. So that's why they were made, as far as I'm concerned. I reiterated this point about the disclosures outside of Canada because, as we will see when we get to the third piece of legislation, the eHealth Act, it has not been similarly amended. I think it's interesting if we look at the next two slides dealing with the response of the Commissioner to these amendments and their non-application to the health sector. So basically, the Commissioner issued a news release, as we see on this slide, and as we see on the next slide, she sent a letter to the Minister responsible for PEPPA expressing her concerns about the fact that the data linking rules did not apply to the health sector. So it may be, as a result of this, and potentially some other things, that she is thinking, and perhaps there's been not necessarily a commitment, but a government sort of thought that maybe at the end of the day in BC, to deal with the data linking in the health sector and other issues, that maybe it's time for BC to think about enacting what I might call omnibus personal health information. If we move to the private sector legislation, PEPPA, and as I mentioned, there are certain entities like physicians, pharmacies, private labs that are going to be subject to this. What PEPPA says is, yes, information may be disclosed without consent if the information is required in individually identifiable form. Again, the no contact linkage is not harmful and the benefits outweigh any risks. I think what you have to keep in mind about PEPPA is that, and again, similarly to FOIPA, is that it applies to all personal information, not just health. So you see a lot of provisions that are sort of trying to fit square pegs in the round holes, if you will, for those of you that have come from and work in the specific health research environment. So what's happened, as we see in the next slide, because of this sort of or very general application of PEPPA to research, is that there has been some work that's been done between the Privacy Commissioner and the BCMA with respect to any requirements that should be included in research agreements when health information is disclosed by organizations subject to PEPPA for research purposes. And the next slide indicates, some of those particular criteria. And even though, as I said, the Act itself doesn't require this, if you look at those joint guidelines, you'll see that if the disclosure is of identifiable data, the guidelines provide that REB approval is required. And again, in this case, there's no restrictions on disclosures outside of the province. I'd like to turn next to the eHealth Act. And this just adds, in my view, sort of another layer of complexity to process and efficiency for researchers to access health information in the province of BC for research purposes. So, as I said before, this applies to designated health information banks, and the Act itself sets out the requirements for the minister to designate such banks, how they're described, the purposes for which the banks must be established, any rules on disclosure of information from those banks, including disclosure for research. And in the context of disclosure for research, even though that's one of the purposes for which data may be disclosed, in the description of the designation order for the HIB, at the end of the day, it's a Data Stewardship Committee, a DSC, that is solely responsible for managing the disclosure of PHI from these designated banks for research purposes. So if you look at the next slide, you'll see that the Act itself, and leaving aside what other requirements that may be mandated by the DSC, the Act itself sets out criteria. So you're a researcher, and you want to apply to one of the data stewardship committees to access info in one of the health information banks for research purposes. These are the criteria that that you must follow. So again, we see certain common elements. You need PHI, i.e. identifiable information. Again, prohibitions on contacting the individual unless the commissioner approves the purpose, the contact, and the manner in which the contact must be made. So you'll see some of these were effectively copied, I think, from FOIPA. Again, if we continue on the list continues, linking not harmful and a benefit risk analysis. And bringing into the rest of sort of the security safeguards that the DSC has imposed conditions with respect to security, confidentiality, destruction, and subsequent use. But I'd just like to sort of take a little breather for the moment and talk about the discretion of the DSC and how it's a little bit, I think, confusing as to how the provisions of FOIPA and PEPPA and the eHealth Act work together in BC. So I thought I would take an example of data that a researcher might wish to access for a research purpose. So the example I chose was identifiable data related to prescriptions. So when I was thinking about this, I thought, if you look at that data set may reside in 3 different places that's subject to 3 different legislative schemes. And bits and pieces may sit in different places. So, for example, it may sit in pharmacare, subject to FOIPA. It may sit as a designated HIB as part of the electronic health record, and it may sit in a pharmacy. So let's assume for the moment, and I'm not suggesting this is the case, but I'm using this as an example. even if the data is to some degree duplicated in those 3 data repositories, they're subject to 3 very, very different rule sets. And subject to the exercise of discretion, which a DSC may impose, then you may have to jump through more hoops in that particular space. Remember as well that I pointed out with respect to disclosures outside of Canada, the eHealth Act is not been amended to deal with that. So if you're looking at data disclosures from there, there's potentially a concern at this point as well. And another thing that perhaps somebody who's from BC is more enlightened than I am, but it has to do with the transparency of any of the requirements or processes that are developed or generally set by the Data Stewardship Committee. So I did a little searching around last night to see if there was anything that was publicly available online to see if there's been a publication of these rules. So, as I said, perhaps those of you from BC may be more aware, but I went to the Data Stewardship Committee Secretariat website, as well as did a little drill down from there, and I couldn't find anything that was instructive with respect to allowing somebody access to the information that would advise them how to go about making an application for research to the DSC. So to summarize very quickly on the next slide, BC, different rules, procedures, processes, depending on where you want to access the data from. And I just raised the question of the possibility of consolidated health information legislation in BC like that we see, for example, in Ontario and Alberta. What I did do on the next 2 slides was compare some of the key legislative provisions across the provinces. So I guess one of the reasons that I did this, not only to sort of have a record of what's required there, I guess I thought that it demonstrates some of the challenges if you're involved not only in BC, because I think I've highlighted some of those challenges, but involved in a research project that's a pan-Canadian or multi-province project where you're trying to access information from different jurisdictions and trying to manage the rules and the processes that apply depending on where that data sits. So with that, I'll leave a little bit of time for questions. I apologize for the technical difficulties at the beginning, but the next slide is my contact information. And so any questions you've got, Cal had explained how to type them in, and I'll do my best to answer them.
Okay, great. Well, thank you very much, Anita. This was great. Now I will, as we're waiting for questions to come in, I will ask a couple just to get us started. You mentioned in BC for FOIPA, RIB approval was not required. I think if this is academic research and practice, you will not get any publications out in a journal unless you've had RIB approval. So to the extent that the objective is to publish results, RIB approval would be needed, irrespective of whether it was required by legislation or not. But my question was around the disclosure of de-identified data. You talked a lot about identifiable information, but would de-identification allow the disclosure of the data without some of the hoops that you mentioned?
Well, I think that goes back to a basic issue as to a point that you and I have discussed and will continue to discuss, and that is whether or not the data is what the definition is of de-identified data. And so while technically, based on the provisions of the Act, you don't have to go through the hoops. I suspect what might happen in practice under FOIPA, say a researcher made an application to the Ministry of Health for access to data that was, in their view, de-identified. If there were any doubts, if the Ministry of Health, in that case is a public body, had any doubts, then I would suspect they're going to send you back through the hoops process. Because, of course, if you look at the REB requirements, they seem to apply to data that is also de-identified. So I don't think it's 100% clear.
Okay, so even for de-identified data, you have to go through some of the hoops.
Pardon me?
So even if the data is de-identified, you still have to go through some of these hoops.
I think so, unless of course, the public body is satisfied that it is de-identified and they're not going to require it.
Okay. So we have a question here from one of the attendees. Do you want me to read out the questions for you?
If you could, I see part of them. If you could read them out just to make sure I've got them all here on my screen properly.
Okay, perfect. So the first one is, in provinces other than BC, such as Alberta, what legislation applies when linking data that involves not only health information, but other personal information, such as educational scores, for research purposes?
All right, so if we take Alberta, there are provisions in the HIA that, as I said, deal with linkage of health information. So if you're talking about, are you talking about linking health information to other PI, or are you talking about linking to data sets that are PI and don't involve health information? Because if you're looking at sort of two non-health data sets that you're thinking about linking, then that would take you back into FOIPA, the Freedom of Information and Protection of Privacy Act, under in Alberta, and I am not 100% sure if there are requirements under FOIPA with respect to any approvals that may be required before you link non-health data.
I think the intention is non-health with health data.
So it's with health data?
Yes.
Yes, you would, because the linkage doesn't say health data with health data. It's health data with other data.
Okay. There's another comment or a statement. For your information, in BC, most data stewards use REB approvals as a demonstration of scientific merit in order to meet BC PEPPA requirements in Section 35, such as public benefit.
Oh, that makes sense. Yeah. And also for the other purposes that Cal had mentioned. Thank you for that.
Okay.